so many of my patients were sick. They have these chronic diseases, diabetes, heart disease, vascular disease, all these terrible things, and they just never got better. And nobody understands the importance of taking care of yourself, of eating healthy, exercising, because at the end of the day, being at a good, healthy metabolic state in your body is so important. It's almost like the foundation of everything that comes afterwards.
Welcome to Beyond the Scale, where real health gets deeper than just the numbers. I'm Dr. Darren Dubyak.
I'm Alexandra Dubyak, and we are not only partners in life, but also passionate partners in integrative care.
Blending faith,
family,
functional wellness,
and a little life with our dogs.
Because true healing happens beyond the scale.
This podcast does not contain any medical or health-related diagnosis or treatment advice. Content provided on this podcast is for informational purposes only. For any medical or health-related advice, please consult with a physician or other healthcare professionals. Further, information about specific products or treatments within this podcast are not to diagnose, treat, cure, or prevent disease.
Hey guys, welcome to Beyond the Scale, and I'm Dr. Darren Dubyak.
And I'm Alexandra. I'm a nurse practitioner, and we work together.
We work together. And I'll tell you what, so our first episode, I think it'd be fun, Allie, to let everyone know who we are, why we started the podcast, right?
Yeah, I love that.
Allie is very scripted, everyone. So we're laughing and chuckling because she wanted every question printed out so I could ask her. And I don't do that. So I'm very much on the fly. So
we just kind of argued for 5 minutes before we hit record because I wanted to know exactly what questions we were going to be asking.
Exactly.
So,
I feel like Ricky Bobby right now with my hands and the mic. I feel like they need to be, what do I do with my hands right now?
I know. Because they can't see the whole mic. So it's like I wonder if they wonder what it is.
I know.
The mic. It's not.
Hey, well, listen. We thank you guys for joining us. We're excited. Yes. This is part of the evolution of not only the Dubyaks, but Body by AIM. And so many people have asked, well, how did you guys come together on this? And first off, how did we even come together? So, Allie, why don't you let everyone know that you asked me out first?
Oh my gosh. He's so silly.
So I think that the funny part is, Allie and I have been together for 8 years now, and we've been together 5. We've been married 5, excuse me. And the thing that I love about my wife is this one big thing, because on our first date, I told Allie I was going to marry her, didn't I?
You did. Yeah,
and she didn't run. So, and on the third date, I not only said we're going to be working with each other, but I said we're probably going to have our own radio show, TV thing, or podcast. And guys, 8 years later, drum roll.
We are.
Here we are.
Babe, we're really doing it.
We're really doing it. And, I love watching you on camera, and I love watching doing this podcast here, because behind Allie, it was one of the greatest gifts we got.
Bumping your computer and it's...
Sorry. It was one of the greatest gifts we got is that I got my wife our song that we danced to. Why can't I think of what's the word for it?
Wow.
Our wedding song. Thank you. We were married on 8/21/21, and it was Chris Stapleton's Millionaire. So that's what's behind her. So pretty awesome stuff.
All right.
So Allie, I tell you what, I
have to keep him on track because he'll be in New Zealand in 3 minutes.
I will be. I will be. But hey,
let's first start with the fact that we both work for Body by AIM 360. It's an integrative medicine practice right outside of Pittsburgh, PA. And this actually started out as my husband, Dr. Darren Dubyak's baby. What, 2016?
Yeah, so 10 years ago, I started Body by AIM 360 in integrative practice in the city of Pittsburgh. We have grown rapidly the past 10 years, and fast forwarding to here we are today.
Mhm.
Allie, I think you joined the practice when?
I joined the practice in the fall of 2020 and, the craziness of COVID.
Right. Yeah.
Yeah, Darren just happened to, he needed a nurse practitioner, and I remember him saying, like, "Allie, I need a nurse practitioner." And I said, "Well, I don't know. I'll think on it and, see who I know might be interested." And he looked at me and was like, "No, I need a nurse practitioner, like, as in I need
Mhm.
you."
Well, what were you doing? Tell everyone what your background
Yeah,
is.
so I'm a nurse practitioner. I worked in family medicine for a number of years before I met my husband, before we started dating. And yeah, that's it. I mean, family medicine, seeing patients every day. My practice still rounded in the local hospital. We still saw all of our own patients. So I spent time in the hospital as well. And I don't know, it all happened kind of during COVID. I was in the hospital. It was craziness, as we all know. And he somehow convinced me to go work for him in an integrative medicine setting, which was completely different for me. And if you guys don't know what integrative medicine is, I think it's becoming more of a popular term nowadays. But at the time, I wasn't even totally familiar with it. So, integrative medicine is kind of the best of both worlds. You have this medical side that we're used to, and then you have this holistic, more natural side. And we just kind of mash those together. And I always say it's the best of both worlds. So, I came into this in late 2020. And gosh, I had so much to learn that I
Mhm.
was not taught in NP school, and, it was hard for me. It was so it was hard for me. It was
Yeah,
a
and
really difficult transition for me because we're not taught about healthy ways of eating. Yeah, we can tell everybody to eat healthy, but people think healthy means like, oh, I'm going to pick up that box of cereal because it says that it's high in fiber and heart healthy. Meanwhile, it's, a serving has like 30 grams of sugar in it.
Mhm,
Oh, no, we just tell people, hey, eat healthier.
mhm.
So, um, yeah, I don't even know where to begin with that.
Well,
Honestly, I
I
don't.
think
There was so much to know and to learn that I had never been exposed to before.
so. First off, I appreciate your openness and honesty because, guys, that is what happened, right? My wife, who was a complete tunnel vision, allopathic mindset, 100 million%. Married me, saw all these supplements, not
Mhm.
only in the office, but in the house, and
Yeah.
saw these vitamin IVs that we did. And just there was a lot of questioning and why. And the reason why I appreciate Allie's humility so much is she goes, I need to learn some of that stuff, right? And
Need
this
to
is
learn
even
all of it.
before you started working with us, right?
Yeah.
And started working with me.
Oh, yeah, that's
And
right, because I was
so
just
my
kind of, like,
background is where
temporary, like,
what's that?
I was just kind of that's right, I didn't I I kinda came in at one point and was just kind of casual, helping out. I forgot about that.
Yeah. And when you came fully in 6 years ago, it was, hey, if we're going to do this, we're going to do this right. So,
Yeah,
um, there was a functional medicine university she went through, just like I did. And,
yeah.
it was really neat to see the evolution of Allie, right? Because you had this young lady who was so brilliant and saw these patients the way she would see them. And I'll give you guys an example, and I'll never forget this. We had a diabetic patient here at the office, and we'll talk about how our office works, but regardless, we treated that patient with supplements, vitamin IV, some peptides, and nutritional coaching. And in 60 days, we can completely reverse. Remember this? Completely reverse this patient's diabetes.
Yeah.
Allie literally said, "Well, what's the dose of metformin you're on? Are they on Jardiance?" Like, Allie couldn't get it through to herself that there was no medication involved. And it
Yeah.
was really awesome because I always tell people, that's the dark side. Let's bring you over this way. And it was a really nice way to see Allie mature
Yeah.
into what we do now. And over 8 to 10,000 patients later working together, you know, people said, well, you guys need to do this podcast. The Dubiaks are becoming this thing in Pittsburgh where people need to know about you. And I like to tell Allie, and by the way, she cringes at this, but I think we're really the first couple in integrative care and integrative medicine. So many people use that word functional medicine, but
Yeah,
Body by AIM and how the Dubiaks really run our practice is truly integrative medicine.
it is.
But on our next episode, we're going to talk about how Body by AIM does it differently than anybody else. This first episode is more like the lives of the Dubiaks, right? Uh, but it's really neat.
Yeah.
So in our title, Beyond the Scale, it's a little bit about our faith, our fur babies, and functional health, right? I mean, I have OCD, so I have this beautiful home that Allie comes into. My floors were spotless. There wasn't dust anywhere. And all of a sudden, Allie brings a 140-pound German Shepherd into my life, right? That I fell in love with. And it's amazing the thing that love does to you, because the OCD quickly went right out of the equation, right? But
See, I
fast
made a
forward now,
man out of you.
you did. But now we have two fur babies, two big German Shepherds.
You.
Allie and I have both been born again, I guess you could say. So Christianity and
Yeah.
Christ are a big part of how we are as a couple and as our practice. We know that God gave us this gift to treat people. And our
Mhm.
patients know that. And that's a big thing that we wanted our podcast listeners to know, is that it really is about faith, family, our fur babies, and functional health. And if you take all those things and you just lump them all together, I think that is life. Al, would you agree?
I mean, it's our life.
Yeah. And it's
So
a fun life, right?
it
So
is a
we just did a
fun
video on what it's like working with your spouse. So
life.
every day to me
Yeah.
was sunshine and rainbows. Obviously, to the
Oh my
other spouse,
gosh.
it's not sunshine and rainbows every day. I'm a
It was
lot.
more
I'm
just
a lot.
to get a
I know I'm a
rise
lot.
out of people. I obviously love working with you, but in all seriousness, you do drive me crazy.
Yeah. You know,
But
I think it's a testament to the so guys, we have three offices. We have a big gathering of patients, and it's really hard because business is the conversation piece of our lives, right? It's
mhm.
besides our dogs, it's a lot of business. And it is
Yeah,
hard to come home
really is.
every night and not talk about business or work and things like that. And I do a really good job shutting off, but someone really doesn't. So I never thought I'd have to force someone to go on vacation to shut off, but I have to force her sometimes. Huh.
Ugh, well, you know, the yin to my yang.
Exactly. I love it. But it's a great way of working with each other.
Yeah.
I'm
Well,
very happy you guys are listening, and I hope that we can bring something to you from a couple standpoint, working together, but also on how we treat patients and how we treat different scenarios, right?
yeah. Well, I think it's important in this episode, like, what was your why? Why did you start Body by Aim 360? I mean, because it
Yeah.
came years before you and I met. So I think
Yeah.
people would wanna know.
So I think this is going to lead into our next episode as well, like the birth of Body by Aim. But again, so my background was chiropractic care. I always had a very big knowledge on nutrition and supplementation, and going through and getting certified in functional medicine and the American Academy of Anti-Aging Medicine and A4M. It just really opened up my eyes to so many different facets of care, right?
Mhm.
And I saw that, man, we're really doing people a disservice if you're not hitting all these, check boxes, right? Um, and it's kind of how it all started. Actually, it is how it all started, right? So, I had this one chiropractic office. That's how I started, with two employees, and I'm helping someone with pain, but
Mhm.
not knowing there's bigger things that made up the pain, the person's stress level, past injuries, a trauma, yes, the recent pain of why they were in their job. So it was that person's story, right?
Yeah.
And I realized that there was more to what I was doing that could help them. And that's how I started Body by Aim. So I said, well, if we are able to bring in a medical component and utilizing even vitamins a better way or better route of transmission, meaning IVs, right?
Yeah.
Um, different medications or peptides and things like that. So I saw that, wow, when we really brought all this together and even just talk therapy, I mean,
Mhm.
I realized so many people in pain or who've had constipation for years have had just trauma. And it doesn't necessarily mean a physical trauma. It can mean a chemical trauma. It can mean a mental trauma, something,
Mhm.
a death or a breakup. And I realized if you would just shut up and listen to the person in front of you, they're going to tell you what they need. That person's going to tell you, hey, I know I'm in pain, but there's other reasons. And one of my greatest mentors would always tell me, sit on my hand, shut my mouth, and let the patient tell you what's wrong with them. And ask a patient what you or what they think's wrong with them, right? And Allie, you see me doing that all the time in practice where I'll come to someone and just say, why are you here? Why do you think these things happen to you? Right? Because a lot of times people want to be heard. And they want to be heard on maybe, hey, I'm not making these things up. So again, coming back to why I started all this, I believe that Body by Aim is really a true 360-degree approach to care, and when Allie was working in family medicine and she started questioning, what are you doing every day and how are these things working? I knew I had her, by the way. So it was it just wasn't me being persuasive. It was easy. And then bringing you out of primary care, I think that watching you, for lack of better terms, blossom into a nurse practitioner who is wonderful in hormone therapy and every other piece of dynamics of Body by Aim. It was really awesome, honey, to see how much you've grown. So but, let me ask you this question. So you asked me what was the birth of Body by Aim, but when you came into this clinic 6 years ago, oh, this is really good. I'm going to put her on the spot. Are you happy you
Please
did
don't.
now,
Please don't.
knowing what you know now of how medicine's being practiced in this type of facility versus how you were? Do you have any regrets joining your husband in this practice?
No. No. I don't.
What's
I
fulfilling in
listen,
treating
I
people this way?
thought, as a nurse practitioner in family medicine, I always thought I was good at it because I was passionate about it. I like to believe that I'm knowledgeable and I don't know everything, but if I don't know something, I'm gonna try like hell to find the answer. And so I always thought, hey, I think I'm really good at this, right? At being a family medicine nurse practitioner. But unsatisfyingly, my patients just never, not all of them, like, I see patients for everything. And some of them, yes, they get better. They have a cold, they get better. But so many of my patients were sick. They have these chronic diseases, diabetes, heart disease, vascular disease, all these terrible things. And they just never got better. And nobody understands the importance of taking care of yourself, of eating healthy, exercising, nobody none of my patients understood that. I could say to them, "Hey, you need to exercise, you gotta lose some weight. Hey, you need to lose some weight just, to get your diabetes under control. You gotta eat healthier." But nobody ever got better, it felt like, with these chronic illnesses. It was just a matter of how long is it before they have another exacerbation of this chronic disease before I have to see them and treat them again. So that's not the case in our practice, right? Our patients get better. Our patients end up having to have a conversation with their PCP because they have lost weight and now their blood pressure is low. They have to come off of blood pressure medications. They get off of diabetes medications. They get off of cholesterol medications, all these meds that have side effects.
Yeah.
When that was the answer when I was in primary care. It was always like, what medicine can I treat them with, or what procedure or tests do they need to have done? And now, when we use medications, it's just a temporary fix for us, right? It's there to help get them to their goal. And then we've given them the other tools to help them maintain, because at the end of the day, I mean, being at a good, healthy metabolic state in your body is so important. It's almost like the foundation of everything that comes afterwards. So, to kind of circle back to that question, no, I don't regret joining this type of practice. It's been incredibly rewarding, and I absolutely love seeing our patients feel the best
Wonderful.
that they've felt in 10, 15, 20 years. I love our patients saying, I can get down on the ground with my kids or my grandkids, or I can go hiking and out hike my, 10-year-old son because I have so much energy, or I haven't looked like this since I was in high school. Like, that is so worth everything. The patients
So
get better.
all of America's listening right now.
They're not.
How is it working with your husband daily?
Fingers.
And my
Ladies and
feet.
gentlemen, I love it.
Yes. Yes. All
No,
right.
it's good.
I
We
love
make a
you.
good team.
We
We make
make a
a good
great team. So listen, I think that what you just said
team.
is a great way to end our first segment, our first
Agree.
podcast. The next podcast is going to be about the birth, the conception of Body by AIM, and what Body by AIM really means, and a little bit about our faith, our fur babies, and
Functional wellness.
functional wellness. So
And
I
here's
hope
to
you
you not
guys.
bumping your computer through
I
the
will
whole
stop
next.
bumping my computer. I'm learning this. This is my first episode. God, jeez.
Hey, we're all
Well, you
learning.
just do
We're
things
all learning
perfectly.
here.
I know.
All right. Well, until next time.
Till next time, guys, Beyond the Scale, thank you for watching. Tell everyone about this episode. Watch us, because it's going to be a comedy show, I think, as well throughout these episodes.
Well, there will be that too. So thanks for spending time with us on Beyond the Scale.
If today's episode helped you see your health differently,
Like the show, share it,
and we'll see you next time on Beyond the Scale.